thanks so much for taking some time for us today.
Thank you. This is fun.
So tell us about your background. How did you get involved in cell therapy?
So I actually started as an ER doctor. So I did ER medicine for about 10 years in Austin, Texas. And towards the end of that, I started kind of seeing that patients were coming in over and over again with these chronic medical problems that I wasn't really able to do much about, in the 10 minutes that I would see them. At the same time, I was also super stressed and not sleeping and drinking tons of Diet Coke and just kind of at my wit's end, and decided that I needed to make some changes in my own health in order to kind of make myself better and also to make my patients better. So I started becoming interested in preventative medicine, and then that kind of eventually became interest in regenerative medicine, so I could kind of learn about how to make your own body heal itself.
Yeah, you're definitely a long way from emergency room care.
It's very different.
Could you have imagined it while you were in school, or why'd you pick emergency care?
I love the idea of being kind of a handy person to have around. Like you're out in the woods and like someone breaks a leg and they're like, "Where's Amy?" So I loved that idea. And it was super fun for 10 years. It was great. It's a great job. But it's taxing on the body and emotionally taxing, and eventually I just wanted to do something new that I thought would help people in different ways.
And how did you make the shift? So you just did you do research first on regenerative care, or what got you there?
Yeah, I spent several years kind of reading and learning, and then I became involved in the A4 on the American Academy of Anti-Aging Medicine Fellowship Program, which was another year-long kind of educational process, and then just started attending conferences and courses, and there's a lot of self-learning in this field because there's not sort of one set way to do it.
Right.
And then eventually I gave my notice in the ER, and I was like, I'm just going to do it. I'm done. And that was it.
So what does your practice consist of now? So what are you doing for most of the time in your practice?
So I have two practices right now. I have kind of a big integrative medicine practice, and where we do all kinds of things from preventative medicine, naturopathic medicine, sports medicine, bioidentical hormones, weight loss, all of that. And we also do some PRP, some regenerative medicine with platelet-rich plasma. And then I have another practice where I do primarily stem cell treatments for things like skin rejuvenation, hair restoration, and sexual optimization.
And do you use cell therapy in both aspects of this practice? And what are you doing mostly?
So I use platelet-rich plasma for both, so that's not actual cells, of course,
Right.
but I use the PRP in both practices, and then I use the cell therapy in just one practice that's basically just stem cell procedures.
And so some of this is, as you said, for maybe aesthetics or sexual function. So how does cell therapy work for that?
So you can use the PRP and the cell therapy, the stem cells, exosomes, all of those things. They work, well, kind of almost everywhere in the body. They're helping your own body to heal itself. You're increasing blood flow and blood vessel formation, collagen production, things like that. So, we can kind of put them where we want them, and then they can signal the stem cells that are already in that area to kind of get back into regenerative mode to help make that tissue more youthful.
And I think, because our topic, is really kind of focused on pain, but I think what people need to be aware of is that there's other applications for some of these therapies. And I guess the fundamental biology that's at play here, works for aesthetics as it would for, regeneration, I guess, is aesthetically desirable as well as, can reduce pain, et cetera.
Yeah, and I find that, sometimes people are nervous about coming in to get treated for skin rejuvenation or hair restoration or the sexual stuff. All three of those things are kind of like almost taboo kind of areas of treatment. People don't want to talk about it. They're embarrassed to tell their friends about it. But they're all things that if you have improvements, then people become very confident, and it helps their self-esteem, and it really affects the way they kind of go about the world, go about seeing the world. So, oftentimes we'll do procedures where we're treating, not me, but treating the musculoskeletal, pain as well as doing some facial injections or doing some hair injections. So we can kind of do several things at one time, which I think is great.
So talk about taboo subjects then. How does this relate to sexual function? Like what kind of interventions are there available for that?
So we do a couple of different things. For men, we do the P shot or the Priapus shot, which is that's just PRP by itself. But then I'll also oftentimes add in other kinds of cellular things like exosomes or stem cells, depending on the person. So we're actually injecting the penis, and that will help with blood flow and erectile function over time. And then we have something similar for women called the O shot or orgasm shot, where we're also injecting in the women, and same kinds of things. We can see improvements in sexual function and tightness and responsiveness and things like that.
Are you seeing good reports as far as your case reports, feedback from patients saying, wow, this is really working?
We do, definitely. I think it's important to also kind of search for like, other problems or causes of whatever the dysfunction is. It's like, for instance, for men with erectile dysfunction, you always want to look, and see, do they have other risk factors for heart disease or, diabetes, high blood pressure, high cholesterol, smoking. You got to get their like lifestyle kind of teed up also. Hormone replacement. Like it's a whole thing, right? It's a whole like whole body approach. But when you do that and you look at the whole body and you treat the whole body, then adding these regenerative therapies along the way can be really helpful.
Yeah, because many times, something like ED might be more systemic as far as what the cause is. This is just a
Right.
symptom as compared to
Exactly.
a local problem, right?
Yeah.
But nonetheless, local treatment in the way that you're doing it seems to yield results for these people.
It does, yeah. And I also will combine it with shockwave therapy, which works great. The regenerative treatments, injections, plus this low intensity shockwave therapy is sort of a game changer for treating ED in men. And then just addressing whatever the root cause is as well.
Do you feel like an artist in this because you seem to be mixing different things and kind of like creating these new colors? So how do you less technician, more artist, or how do you feel about it?
I mean, that sounds good. I like that. Yeah, I mean, I think it's important to just, you don't want to just do procedures and walk away. Like you want to figure out what's actually going on with the patient. And there's, patients have stories that then they'll tell you kind of what's happening if you listen to them long enough. So this is one thing about this medicine now that I'm practicing. I like that I have time to sit with patients and just have a conversation and learn about what's happening with them from a health perspective. Mm-hmm. Whereas back when I was in the ER, it was like 2 minutes and I had to get to the bottom of it and then I was done. So it's nice.
How are people seeking you out? How are they finding out about these types of therapies that you do and showing up at your office?
A variety of ways. Some people get referred by their doctors, like primary care doctors, sports medicine doctors, things like that will sometimes send patients in. And then a lot of people will just find us on, I've done a lot of podcasts and a lot of kind of social media stuff. Had some patients that sort of are influencer kind of patients and they've gotten the word out. So it's been interesting because it's one of those things that, coming from the ER, I'm not a marketer. So learning how to get people in was not ever my thing. But they're coming. So I guess they're finding us somehow.
And most, I imagine, are paying you out of pocket because these types of services usually aren't covered by third-party pay.
Yeah, that's right. They're all cash procedures. Right now, insurance doesn't pay for most of these kinds of things.
So in the mix of what you're doing, because you said you also do some pain therapy also, so is that building maybe a reputation saying, hey, we've got these various interventions that we do. They have multiple applications. So, you basically don't have one particular niche that you're doing, or would you say that, yeah, there's a niche and these things are kind of peripheral?
So my niche is more the skin, hair, and sexual optimization. However, at both practices where I work, there's someone else there, another doctor, who does the musculoskeletal injections. So if a patient came in and they got their blood drawn for PRP, we could do one blood draw and then we could inject a knee, a foot, a back, and also do facial injections at the same time because we have the ability to just, make a lot of PRP from that patient.
Do you feel like the field is changing very quickly right now as far as what's unfolding, and what are you seeing?
Yeah, it's so exciting. I mean, there's so much new stuff that's coming down the pipe and that's, basically just come out. Interesting stuff with exosomes, which we know about. Lots of interesting work with just sort of fine-tuning stem cell treatments, so it's not just, as just a regular stem cell, but we're actually able to sort of tweak that so they know that it's actually going to make collagen specifically, or it's going to make cartilage specifically. And it's kind of getting some of those stem cell drugs underway is really interesting. But, I love just being able to take cells from someone and put them back in that same person in a safe way and then see the changes that we can create.
So you did emergency care for 10 years. How long have you been doing this now?
About 6 years.
6 years? So are you going to find something new in 4 more years, or is this it?
I don't know. This is keeping my interest pretty well. I feel like with this field specifically, it's changing so quickly that you could never know enough. You're never get to the point where you're like, oh, I already know how to do that kind of CPR. I've been doing that for 15 years kind of thing. Right. It's just always changing, which I love.
Yeah, so where do you think it's going to be in 3 or 4 years? What kinds of things are going to unfold?
I see a lot more sort of off-the-shelf stem cell therapies kind of coming to market. I think, it's right now we do a lot of procedures. We'll take your stem cells from your bone marrow, your fat, things like that, and use them on you. So these autologous procedures. But I think it'll become easier and easier to buy stem cell products, whether they're umbilical cells or exosomes or even more targeted cell therapies. Buy them off the shelf and then use them with all different patients, which is great because then you don't have to do procedures, as many procedures on the patient.
So since you're on the aesthetic side to a degree, I sometimes see like creams and lotions and so on. Are they useful or valid or not really?
It's hard to say. I mean, they definitely don't have live cells in them. So that's one thing to note. Like if it says stem cell cream or whatever, like there's no live cells, obviously, because it has to be cryopreserved. Like the cells require it to be very cold to live. So it's growth factors and cytokines and things like that. And they could be beneficial. The problem with the skin is that because the barrier is so intact, it's hard to get things into the skin, right? To the epidermal barrier. So that's difficult. People always send me all of these creams and things to try, and the difficulty is that there's not a lot of studies comparing them to each other or to placebos or to things like that. So I think there's some good possibilities.
So I imagine that's a part of your role as the doctor and the amount of faith that a patient would have to put into you, saying, there's not a lot of controlled research in a lot of these areas. You're out here kind of clinically perform these things, looking at outcomes, modifying, maybe tweaking your interventions, how you're combining them, playing that artist that's mixing paints, basically. So do you find you're out there constantly trying to test different products to see what works so that you can deliver the best things for your patients?
Yes, definitely, and which I love. I love being able to test things. The thing, it's hard though with skin, for instance. You have to do something for several months before you're going to see a benefit, and so it's one of those things that's difficult that way. But I love coming to events where people are giving me or having me buy all of their stuff, and then I can take it home and I can try it on my husband and myself and my friends and everyone. I'm like the candy man, just handing out stuff.
Well, that's interesting because I guess with these topicals, you're saying there'd be months before you might see something. What is the timelines, when you're doing other types of aesthetic work where maybe you're injecting?
So it's about the same. I mean, usually with these regenerative treatments, we're looking at somewhere between maybe 4 to 6 weeks to maybe about 3 months before we start seeing improvements in the symptoms. And with hair, like hair restoration, is even longer because the hair cycle is so long. So it's maybe 3 to 6 months. So it does take some time. It takes some patience. But it's ultimately worth it, I think, because you get this sort of nice, subtle improvement over the first year or so that people will notice.
So is it typically a series of treatments people have to go through before they know, are they getting a result? And then is it maintained over time? They have to continue to maintain the effect?
So with the skin and the hair, I usually recommend doing 3 treatments spaced about a month apart, and then waiting another year and a half, again, to do another series or at least to do some maintenance treatments. With the sexual procedures, usually 1 or 2 is enough. It depends on the patient and kind of what their, where they are, what their goals are.
Are the treatments themselves painful?
We use numbing cream, so they're not painful. I mean, there may be a little pinch here and there with the facial injections, hair injections. There's a little bit of discomfort, I call it.
Yeah.
But it's not that bad, and it's pretty quick. These are fast procedures and super safe, very small needles.
And I guess that's a part of it too. Is that a lot of times I don't know. Are you doing Botox as a part of what you guys do?
We do offer Botox and fillers and traditional lasers and facials, and we do kind of full aesthetics as well.
But with the cell therapies that you're utilizing, for aesthetics, are they a safer intervention than Botox?
Botox is super safe, so I wouldn't say necessarily they're safer, but they are equally safe. Botox, you can have side effects, you can have droopy eyes or things like that, but it doesn't ever result in lasting problems. Fillers can be dangerous, like the hyaluronic acid fillers and things like that are on the market. And I still use them sometimes, but they can be more dangerous and can cause long-term problems. But the cell therapies are extremely safe, and I haven't had anyone have any kind of complications from them.
So can you maybe describe in a little bit more detail some of the procedures that you actually do?
So for the skin, for instance, I do a couple of different things. On every patient that I do skin, I do injections. So I go in with in a needle and go under the skin into the intradermis and below that, and injecting kind of the deep tissues around the eyes, which kind of helps with this dark circles around these folds here, kind of all around there. And then after that, I do microneedling, which is a little device that has like 10 little needles that just go up and down really quickly, and they only go in about 2 millimeters. So you create these little micro channels all over the face or in neck or wherever you're treating, and then you can apply things like PRP or stem cells topically, and they can get into those little channels and get into the deeper parts of the skin. So that's great for collagen production. All of those things, we're going to see increased collagen production and elastin production and hyaluronic acid, which are the parts of the skin that give your skin the structure and the elasticity and the hydration.
And how long does it take to get all that done in a session?
Like an hour.
Yeah.
I mean, there's the blood draw and the spinning, and then we numb the face with some topical lidocaine, and then do the injections and the microneedling, and then you're out the door and you have a red face, but you're otherwise, you're fine.
And how long does the red face last?
The red face lasts at least a day,
Yeah.
sometimes longer, and you can get bruises. Sometimes people will bruise a little bit depending on where they were injected, but it's pretty low downtime. It's not like you have to, stay out of work for a week. I mean, most people are back in their lives the next day.
So what's interesting now, if somebody kind of shows up and says, I've got a knee problem, I want PRP in my knee, but hey, while I'm here, can you work on my face a little bit too? Does that start to make sense?
Yeah, it happens a lot. And in fact, at one of the places I work, we'll do a lot of these, what we sort of call full body makeovers, where the patient will come in and they'll get, a bunch of different joints injected, neck, back, everything. And then the same session, then I'll do, aesthetic injections, facial injections, hair injections, the P shot, the O shot. So we actually sedate the patient. So they're asleep. So they just go to sleep and they get a ton of stuff injected, and then they wake up and they've kind of gotten this sort of full body makeover.
Wow, how long does that take?
It takes about 3 hours, the whole thing.
So if I'm watching this right now and I'm sitting there saying, yeah, I got a knee and a shoulder, that I kind of want to work on, but the rest of the stuff sounds like it could be kind of fun. What would the cost of that kind of session be?
It really depends on what you're getting done and who's doing it.
The ranges?
It's thousands of dollars, probably starting about 5,000 or so. But again, it depends on kind of what you're getting injected, whether you're asleep, whether you're awake, what I'm doing to you.
Yeah. So do you have an anesthesiologist that you have to have
Yeah.
there also? So
I mean, we don't for everything, just
Yeah.
for those sort of full body patients. For most of my procedures, the patient's awake and they're in and out in an hour. But if we're doing a bunch of injections, people get kind of this injection fatigue, I call it, where like after they've gotten injected, more than 5 or 6 or 10 times, all of a sudden they're like, and I'm done.
Yeah.
And so it's nice for them to be asleep.
Do you find there's a lot of your colleagues that are now migrating into this direction from other forms of practice?
There definitely are. I teach a course for physicians where I teach some of these techniques, these regenerative aesthetics and sexual techniques. And so, it's always fun because I'll have a classroom of, all different doctors, OBGYNs, family practice, plastic surgeons, dermatologists, radiologists, like people from all different specialties have become interested in this field because they've seen kind of what it can do, and it's exciting.
Yeah, I mean, it's this sort of brave new frontier. So for the more entrepreneurial-minded, doctors, they want to move over to here. You don't have to deal with third-party pay, which is never a fun thing to do if you're a doctor or a patient.
Right.
So it's kind of like this brave new frontier that can be explored. What do you think the future of it is?
I mean, it's just going to keep going up. It's going to continue to be more and more popular, and it's going to be available to more people at a lower cost eventually, which I think is fantastic. And it's going to take some time to get adopted, I think, by mainstream medicine, But already there's so much research out there that we know it works, and we just got to figure out, kind of fine tune it, figure out how it works the best, and then try to get it to more people.
That's great. And maybe as a final thought or question, does your regulatory boards leave you alone to do what you're doing right now?
As long as you're staying within you have to obviously follow the rules and make sure that you're not doing anything that's out of boundaries. And those rules are always changing, so we have to make sure that we're aware of what those rules are.
Yeah.
But yeah, I think that the boards are supportive as long as we are doing our job correctly.
Terrific. Well, I really appreciate you sharing what you're doing and bringing all the energy to it that you bring, and I hope that it's informative for some people who are considering this.
Thanks for having me.
Esty, thanks for sitting down with us.
Absolutely.
So tell me about your background. How did you grow up and how did you get into what you're doing?
So when I was a young girl, I had had 9 car accidents.
9 car
Nine,
accidents?
yes.
Did you
So,
consider yourself unlucky?
absolutely. So I grew up with a lot of chronic pain, going to a lot of different doctors. I grew up in a household where we used primarily supplements, things like that. We always saw a naturopath. But I had to go and see allopathic doctors that were giving me high doses of pain medicine, facet blocks, epidurals, things of that nature. And by the time I was 18, I was in a wheelchair. So it was one choice or another, and I was going through school and I was on track to be an interior designer. It wasn't something that I wanted to do. It was something that, because of my accidents, that I was pushed into the arts. Finished that degree, and while I was in my undergrad, I found a naturopath who absolutely changed my life. They used IV therapy, supplements, prolotherapy, and PRP, which allowed me to be able to walk properly again, restore function in my body, come off medications that were causing me to eventually have liver failure.
You mentioned something I think that's critical to understand for people who suffer with chronic pain is that these medications aren't vitamins, that they have these adverse effects. So you, as a result of the medication, went into liver failure?
Well, it was something that they had told me within 15 years you will have liver failure because you will be on X number of medications. And my parents were very proactive trying to find me the best solution. And what they did is they found me a naturopath and a sports medicine doctor, actually from Spain, who worked with me every single week using acupuncture, TENS units, prolotherapy, IV therapy to essentially change my life. I had a very great diet, but with all of the medication, it wasn't helping.
So now you have this outcome where you're like, wow, a whole different approach, whole different point of view, and I got my life back.
Right.
And you were wheelchair bound, in school for the arts or interior design. Now you have this experience. So what changes for you?
So what changed was halfway through when everything was changing, I told my parents, I said, I don't want to do this. I want to go into naturopathic medicine. And my father was very stern, said, you're finishing your undergraduate degree, getting your BSc, and then you can apply to naturopathic school. And that's exactly what I did.
And so you went through school, you got out. Had anything changed for you by then, or you still said, this is my purpose in life?
No, it actually had gotten stronger while I was in school. So while I was in medical school, my mother was diagnosed with cancer. And she had gone through radiation, partial mastectomy, and we had done everything possible. And naturopathic medicines actually saved her life. We opted to not do chemo or any of those drugs, and she's still here today.
Wow. So you just keep getting all these signals and
Yeah,
lessons, huh?
absolutely. Yeah.
Wow. Wow. And so now you get out of school and you have this mission because
Yeah.
it obviously had such an impact on you that you wanted to bring this to other people.
I did, yes.
So what did you start doing in practice?
So while I was still in medical school, I figured that pain management was something I was very, very adamant about focusing in. So I actually took the Hemwell Hackett prolotherapy training while in medical school. During that time, while I was doing my internship, I did another 20 to 30 hours every week with my mentor over and above so that I could really hone my skills. After that, I was an adjunct faculty at the School for Pain Management while opening my own practice to start helping people.
Was there anything about the current state of the art in pain management that you found limiting or wrong, or saying, there's something better here?
Absolutely. So using IV therapy, nutrition, lifestyle, those are all great. Prolotherapy and PRP are very, very good. But then I stumbled upon stem cells.
And can you explain just what prolotherapy and
Sure.
PRP is?
So PRP and prolotherapy is proliferative therapy. What that is it goes an injection into the joints. You're using dextrose, a lidocaine, and a sodium bicarb buffer. That causes irritation into the area. for white blood cells to come there, the body thinks it's a brand new injury and helps to heal muscles, ligaments, tendons, things of that nature.
Is that usually used with kind of chronic pain that's not resolving?
It is, and sometimes it's used in acute pain. One step up from that is using PRP, which is platelet-rich plasma. That's where you draw the patient's blood, and then the platelets are injected back in. It's one step up from the prolotherapy.
So why is that effective where you're drawing platelets out? What are you doing to them and then re-injecting them? Why does it suddenly have a healing property to it?
So you're extracting the platelet-rich plasma from the red blood cells. What that does is that causes, again, an irritation, causes more inflammation so that the body thinks that there's a brand new injury inherently, comes to help heal whatever is going on in that specific joint space.
So what's a little bit interesting about this is that it starts out kind of counterintuitive. Hey, we're going to actually make the body think things are worse, not better.
Right.
But it really facilitates healing
Absolutely.
as a consequence, as compared to more pain.
Yes.
And you've been doing this therapy, and you had it done on you, I guess, when you were in pain.
Yes.
And you found it to be effective.
I did. Very much so. It changed my life.
Changed your life.
It did.
Well, I'd say that's maybe a step above effective.
Yes. Yes.
So now you did this training and you put in your hours and your extra hours. And what happens from there?
So what happens is I was, again, an adjunct faculty member. I also started my own practice. I focus mainly on naturopathic pain management. And I was curious as to using PRP and prolotherapy, there had to be something more, something that would give even longer lasting effects. Because these do give very good results, but I wanted to see if there was something else. And I stumbled upon stem cells.
So when you say stumbled upon, how did you stumble upon it, or what did you find with stem cells?
So in one of the medical conferences that I went to, it was specifically for PRP, they were introducing stem cells. So I thought it was something very interesting. And for me to go home, I thought, let's introduce this to my patients, because I thought about actually a handful of them that could benefit from it.
Did you already had experience injecting
Yes.
With prolotherapy and PRP with stem cells? What did you have to learn to be able to use them effectively?
So not much else, because it's effectively in the same type of joint injection. It's just the amount that I would be using. So essentially it's the same type of injection, not very much different.
And what do you understand about stem cells as to why they work, or what you're actually using in the way of cell therapy? Like what's happening that's creating this effect?
So they are introduced to your body and they're turning on your stem cells. They're turning into whatever your body needs. They also upregulate or downregulate the immune system, help to reduce inflammation in the body systemically if you're using it in that case. Also to help if you need to build some cartilage, it's building tendons, things like that.
Are you mostly injecting this into the joints? Is that how you're using it in your practice?
Yes, there are some times where I use IVs, but most of my patients are joint patients.
And what are you finding? Like, if it's a knee, a shoulder, I guess those are probably common ones that you'd
Yes.
be injecting where people have chronic problems. Maybe they're surgical cases that they want to see if there's an alternative, or
So most oftentimes they're surgical candidates for a knee replacement, and they're coming to me as a last resort. So they've tried everything. They don't want to do that. They want to do this. We have seen very good results. So people have made turnarounds. They're actually walking. They're doing activities that they haven't done in years. Given that also I'm giving them lifestyle, dietary, as well as supplement recommendations, because it's all encompassing. Everything in naturopathic medicine is.
how important are the peripheral recommendations and maybe even interventions to the actual cell therapy? In other words, as far as nutrition, as far as activity, et cetera. As you're recommending these things or giving patients these things with the cell therapy, do you think that that has a big impact on the outcome?
It absolutely does. Diet is very, very important in this, because if you're eating foods that are highly inflammatory and you're trying to reduce the inflammation, you're not going to be able to stop the inflammatory cycle. So that right there is very important. Next step that most of these people aren't even exercising because of the pain. Simple things like walking, just getting those muscles and joints to be lubricated is very important in this. And this is a lifestyle change. This isn't a temporary Band-Aid fix that we're looking for.
How long is the expectation? So if somebody comes in, they're considered a surgical case for their knee, as the example you used. They come in and they get the therapy that you provide. How long before they typically experience results?
On average, in around 6 to 8 weeks. We do have some hyper responders that respond within a couple of days to a couple of weeks, and some take longer. A lot of it is your mental attitude. If you have a positive attitude about this, then things seem to turn around faster.
So it's very interesting to think about. You're bringing up mental attitude as if, so that has an impact. You're saying a big indicator is what their orientation or what their mental attitude is. So why do you think that is?
It's the power of belief. So if you believe that something is going to help you, it will help you. The more positive you are with it, the better it will work. If you come in and say it's not going to work, this is never going to change what I'm looking for, it's not, because you have the ability mentally to control your body.
So it's interesting because in call it traditional medical research, the idea would be to control for that, right? And try to eliminate it from the equation.
Yes.
But in your way of practice, you're actually saying, hey, I utilize this as a part of my tools to get this patient healthy.
Absolutely. I always recommend mind-body medicine for patients, whether it's psychotherapy or meditation, things of that nature. I practice it daily, so for me, it's a huge part in making changes for people that are long-term and fundamental.
Now, you earlier said you found stem cells, but I imagine there's multiple types of cell therapy that might be integrated into what you're doing, or what is your particular approach?
So exosomes are something that I do use. Those are the active proteins. They don't have a casing on themselves. So when they're injected, they actually seem to allow the body to have a faster effect for people. It's a very new field. It's very exciting. We've seen a lot of really good results much quicker, I would say, than using stem cells.
And is it a series of treatments? Is it a single injection? How does that
That
work?
all depends on the nature of the case. Oftentimes, people are done in one treatment. There are some times that they have multiple ailments going on, so that the body needs a little bit of treatment later on. So there are some times where they have one treatment, sometimes where they have 2 and 3.
So there's lots of controversy, in this as far as what the right way to do it is, how effective or what the efficacy really is, et cetera.
Right.
What do you explain to a patient? So now if I'm your patient, I come in and I say, okay, I've got this knee problem. It's been plaguing me for a long time. I've got a lot of degeneration. The cartilage is kind of gone. And they're telling me I got to do a knee replacement, which is a pretty grotesque surgery.
Right.
I'd like to try to avoid that. So now if that's my desire coming into you, knowing that you have experience with this, what do you tell me as far as saying, okay, here's what my expectations are, or maybe to put it in kind of technical terms, what's the informed consent that you give?
So stem cells and also knee replacements, they don't work for everybody. So that's the way medicine works. There's no 100% guarantee. What we do know is that you will have improvement. How much is, like I said, dependent on the person and how willing they are to follow it. You will never be 100% pain-free. I'm able to give that to somebody, because when you've had chronic pain for a long time, chances are that won't happen. There are times where people are looking to get back into running, things like that. Those are the times that we set more realistic goals, where using a lower dose isn't exactly a right amount, using a higher dose is. Oftentimes they feel more discomfort in the beginning, which is completely normal. The body goes through its healing crisis and then starts to turn and feel better. You will feel better over the next couple of weeks, but over the next months to almost a year is where the treatment will have its maximum benefits.
And how much does age factor into this?
Not a lot. It's one of those things that we are not using typical cells, so age doesn't matter. You can be 5, you can be 95. I've seen patients in their 90s, and I've had patients in their 40s, and they've all gotten better across the board.
So it's interesting, 'cause, given your whole background and experience, you were very young when you had a bunch of injuries, right? And literally were living like a very old person,
Absolutely,
right,
yes.
at a very young age, and had these kind of more natural interventions, save you and
Yes.
maybe even prevent a lot of future ailments like liver failure,
Right.
et cetera. And now you're out there and you're helping people. Do you find that if it's somebody that's younger, that's had injuries, maybe they're athletes that injured themselves, which is fairly typical, do you find that they have better outcomes, or they get further as far as their recoveries as compared to older people with chronic pain, or is it really unpredictable? You just have to get in and do it.
It's really unpredictable. Just because you're an athlete doesn't mean that you're going to have a better result. Now, typically they do take care of themselves better. However, they do beat themselves up by whatever sport that they're doing. So it's one of those things, like I said, I've seen very good results in the elderly and very good results in the younger generations.
Has the actual practice with the cell therapy that you're doing in the last year or two, has it changed much? Or is there new things coming out that you're incorporating? What are you finding?
There's always new things that are coming out and emerging. This field is always emerging. So it's very interesting. We're using ozone therapy, a lot of adjunctive therapy. Like I said, supplements are very important to the body. A lot of people have digestive issues, and the gut is the epicenter of everything. If that doesn't function, you hold a lot of toxicity there. So you will hold a lot of pain in areas.
This is where it gets interesting, because you talked about kind of this holistic approach. So the gut microbiome might have an effect on what my outcome is with this therapy,
Absolutely,
right?
yes.
So, and the idea is, I'm making an investment to do this. So maybe I should be motivated to, take your other recommendations.
Yeah.
And is that really one of the things that might differentiate how you're approaching this? Is kind of the holistic
It absolutely
aspect?
is, because from the naturopathic world, we treat the body as a whole. It's not compartmentalized. So just because you have a knee injury per se doesn't mean that other areas of the body aren't functioning properly. And when you're taking pain medicine for a long time, it affects the gut, it affects the liver. So you need to cleanse, and you need to make sure that everything functions.
So with somebody who's been taking drugs for a long time, medications, do you typically detox them a bit as a part of the process, where you're trying to, maybe get some of the toxins out of the liver?
Yes.
Yeah.
So I typically do a cleanse for them, but I allow their primary, if they want to come off their pain medication, that's their primary's job, is to make them however they want to titrate them off. But I take it from the naturopathic side of it.
Where are your people coming from that you're seeing right now? Like, how are they finding you?
All over. So a lot of it is word of mouth. We have some people that have come from Canada. Vermont is a very small state, so it's very word of mouth.
And well, it's also a lot of skiers there, and
There are.
I know those eastern ski conditions, a lot of ice. So there's got to be a lot of knees there showing up.
Yes,
at your
I
place.
do see a lot of knees.
And so with the people that are coming from long distances, how often do they have to come back? Subsequent to the actual treatment.
So in our office, if they're coming in, most of the time it's one treatment, and then we'll follow up with them a week out over the phone, and I have them come in a month just to see how things are going, and then we follow up with them around 6 months to make sure that they're progressing properly.
Now, if I show up, I've never had this done before, and I'm a little bit pain adverse. Is this a painful procedure? I mean, if I'm getting my knee done, is this like very painful, not that painful?
No, I actually have a very gentle injecting technique, so it's very quick. I can use a topical lidocaine if need be, but most of the time patients don't even realize that it's done after we've finished it, and it's a very simple, very quick procedure.
So going all the way back to that very infirmed young girl who then decided to come and do what you're doing, and here you are today, has it turned out better than you expected? Less than what you expected? How do you feel about what you're doing in your life and its purpose right now?
It's better than I expected. My pain brought me to this place. So it brought me to a place where I can help people. And about 5 years ago, I was diagnosed with a condition called trigeminal neuralgia. So it's also known as suicide disease. There's no cure. I've had brain surgery for it. I get shocked in the face anywhere from 5 to 300 times a day.
Wow.
It's like putting your finger in an electrical socket. So going through all of these things and managing everything naturopathically has allowed me to really connect with patients and understand them when they're talking to you and they're really crying out for help and they're just being given another pain medicine. They're just been pushed off or they're given another steroid injection and go home and deal with this. But we're here to help them from an all-encompassing manner. So I would say absolutely it's the right course for me, and it's been very rewarding.
What do you think the next few years is going to look like? Any new things on the horizon that you're excited about?
There's lots on the horizon. I think pushing exosomes a little bit further, seeing what else they're capable of doing, I think is very interesting. When your patient comes in for joint pain and they have several other ailments, it's interesting to see when they come back to report, things have started to normalize that we weren't even treating. That is very interesting.
Speak to that. What do you mean? Like what kinds of things?
Sure. For instance, I had a lady with frozen shoulder. We did her injections. About 3.5 weeks later, she was a very large lady, had diabetes. Her A1C had never been within normal range. And that is the only thing she did was my diet recommendations and our treatment, which to me was very interesting.
Well, so now you saw her A1C improve, which is the lab test for diabetes, basically,
Yes.
if anybody needs to understand that. And how about her frozen shoulder? Did it get helped?
It did. It did. So within about 2.5 weeks, she was a hyper responder, and she was able to pick up her grandchild, move around with her grandchild, and starting to exercise, which are things she hadn't been able to do in a very long time.
So this is interesting. So, and she had no expectation
She
that
didn't.
it might have an impact on her diabetes, that particular condition.
No.
So it wasn't like she thought herself there. Obviously, diet recommendations, could have supported it, but
Right.
you would contend that the cell therapy also had an impact on that.
It absolutely does, because when it goes through, not only through the joint but systemically, it goes through the liver, the kidneys, goes through the heart, the lungs. So the body has an innate ability to heal itself. If you give it the tools to do so, it will do so.
So this gets interesting now because we're broadening,
Right.
the view here a little bit. It's one thing because it's sort of, orthopedic and targeted. We talk about a knee, we talk about a joint, but are there other pain conditions you've been seeing, results with that, other than the things we've been talking about?
Yes, I see a lot of neuropathy cases. So from very mild to very severe. One
Can you explain what you mean by neuropathy?
Sure. So it is a numbness and burning in the feet or hands. Most of the time, my patients have it in the feet. Sometimes they have discoloration. They're cold to the touch. I have one patient that actually comes to mind. Her feet were purple on the first time that I had met her. She was in her 80s, and she had been suffering for a very long time. She was a skier and was still skiing despite all
With
of
purple
this.
feet, she's
With
skiing?
purple feet. So it was something that she was looking for resolution, was realistic that this would probably never go away, but was looking for benefit. Her treatment, after we were done a month later, she came back in and there was color to her feet. Her feet were no longer purple.
Wow. So interesting. So did you do it systemically for her?
I
like
did
an IV?
systemically for her, yes.
And the outcome was that her neuropathies resolved.
So it didn't completely resolve. She still had some numbness. She didn't have the burning. The feet were no longer cold to the touch, and they were no longer purple.
Was she thrilled?
She was ecstatic.
Now, what had she tried prior to that?
She had tried several different medications, had tried acupuncture, and going to her medical doctor was told that there's no cure. So these are the things that we can offer you, but it's a progressive condition and it'll just get worse. So basically grin and bear it.
When you get those results, what's it like to go home that night?
It's very satisfying.
Yeah.
So it's a great feeling to know that I can help somebody.
Yeah, it's amazing when you see people that have literally maybe even start to lose hope, right? And then suddenly, here they are saying, "My God, I got a big chunk of my life back." How awesome is that?
It's very great.
Yeah. Well, terrific. Well, I really appreciate you, sharing your experience with us and giving us all this input and also sharing some of these personal stories, which for me, it always has more impact when I understand, what's the person's journey,
Right.
that got them to be doing what they're doing today. And your journey is certainly something that the faint of heart would never have made it through. So I congratulate you for
you.
going through all that.
Thank you.
Yeah, and thanks for sitting with us.
Absolutely.
Nancy, thanks very much for taking your time to be with us today.
Thank you for asking me.
So Nancy, I can see you have an oxygen compressor. What are you struggling with?
COPD.
How long have you been struggling with that?
I struggled with that since I had TB, and that was from probably 4 to. They finally cleared it out of me. It was slow moving and acting in about '09, and then I had a stroke the next month.
Wow.
So that took out hearing, eyes, and some balance. But the worst part was not being able to breathe. The breathing it, because my chest was always infected.
Wow.
Always.
Wow. And were you also struggling with any pain at all as a part of all this?
Total. Every bone, and I had total arthritis and neuropathy. I think the neuropathy bothered me the most because the zipping pain went across my chest all the time. And I must have an amazing heart. But my hands, I play the piano. If I skipped one day, I couldn't move my hands hardly. And my feet hurt so bad.
Wow. And what kind of treatments were you getting for all this before?
Well, I took gabapentin for the neuropathy, and I took, Tylenol for arthritis. And I could have up to 5 a day to not hurt your kidneys, so I figured 2 a day because you can suck it up.
Right.
Well, anyway, so they all tried to help, but at that point you're just going downhill.
Right.
And I started, my immune system must have been compromised too, because I wasn't out of bed from starting January last year until the summer.
Wow.
And finally, it's when Jan got fed up in October and said, "Why don't you go see Dr. Just?"
Who's Jan?
Oh, my nurse daughter that had come for her back pain. She had a terrible back.
So you had a daughter who was a nurse who had back pain who came in to get cell therapy, and she got good results with that?
Oh, yeah. And hers, like mine, showed great improvement fast. And then you think that's what it's going to be. And 3 months, by 3 months, it's amazing.
So let's talk about that for a moment. So how long ago was it that you got the cell therapy?
I think I got it in October. I think it's four-ish months.
So about 4 months ago. And what have you noticed since you got it?
Oh my goodness. It was so fast, and my delight was so exciting that I wrote them thank you notes. Ever heard of writing a doctor your thank you notes? Because the first thing that happened was all that zipping, the neuropathy. It's not perfect, understand. It's still, there's funny feelings in it, in the hands especially. But all the zipping nerve pain, I can't believe it. It's some kind of miracle, huh? Wow. Stem cell. But anyway, the zipping across my chest was very distracting because at the time I thought my lungs had caused my heart to have troubles. Well, my heart's great, evidently. But what happened, it acted up with all the gasping and trouble. I was in a wheelchair if I had to be pushed.
Wow.
And so
well, I saw you walking here with a cane, but you were walking on your own.
I am. And I'm going to be walking. In 6 months, I'll be walking a half hour a day. In a year, I'll be back at Silver Sneakers for an hour a day. Hour 3 times a week.
You have goals.
I do.
Wow. So is that one of the outcomes of getting the therapy, the cell therapy?
Well, it's all the stem cells because the pain, I couldn't do it anymore. The pain was too much. And what's odd, the next thing that happened, I thought, now that part of the brain I've seen is gone back here. You're talking to a half-wit. But anyway, so what happened is I couldn't believe it. It seemed like what's there, I'm seeing a little better. That doesn't make a lot of sense, but I can see clearer. There's not as many fuzzies. And then I can, the hearing's very bad. That's better. And the chest pain, to be without all that chest pain, not only the zipping of the neuropathy, but it's hard to breathe when you're infected, and I was in the doctor all the time. I must save a lot of money on doctor bills and on the medicines. I still am on nebulizers. I think the TB must have taken out a lot of my lungs.
Did you notice a change in your breathing? You said you have COPD, you're doing a nebulizer. Were you able to breathe better in general?
I think the big change is it not hurting, and it's easier. And I don't think I would try the therapy I've asked for now that I have. For the physical therapy, I wouldn't have tried it. I wouldn't have even tried. I just had given up.
Wow. I know this is an improper question, but may
That's
I ask
good.
you your age?
88.
Wow.
88 and a half.
88 and a half. So
89 in September.
Wow. So,
1930.
because some people would wonder, would somebody in their late 80s, benefit from this? But obviously, you saw almost immediate benefit.
Absolutely wonderful to have, to be the freedom from the pain. And also it must do something to your mental process because the delight I feel, and I'm so appreciative of the stem cells, but also of my family, my home, everything. Everything even tastes better. I don't know, you just
Your
feel
senses
better.
are better, yeah. So
It's a new day, and old age, I don't feel old. I just look old.
Well, this is what's interesting, and without at the risk of sounding like I'm becoming some kind of a commercial advocate, I'm just observing and speaking with you and many others. But you had used the term, basically at a point like you're almost like, well, I'm old, I'm giving up.
I was.
In essence,
For
saying,
the
well,
stem cells, yeah.
And it seems like you've got sort of you walked in here in a very good mood.
I'm always it's repulsive. I'm in a good mood from morning till I fall into bed. Go figure.
Which is
Stem
terrific,
cells?
yeah. So it's amazing that you've had this transformation, and now you're looking forward to more activity, more things, and that wasn't the case before.
I'd given up all my luncheons I like. I have sorority luncheons and that kind of stuff from 60, 70 years ago. I still go to, but not anymore. My daughter said it's been about 3 years since I have done anything. Isn't that odd?
Yeah.
That it would help me. It's so subtle. It's hard because I've had people tell me, what do you think it did for you? Well, what I asked for, it's so much more than that, but it's subtle. And the lungs are better. That's not to say I've gone backward in age. I still have all the age, like this thing.
Yeah.
Used to, I would have had to leave it on. But I'm fine till I get up and try to walk. And then I'd be fine for a while if I didn't get smart.
Yeah.
Yeah.
Well, it's terrific, and I'm so happy for you. That you're having this experience and that you're looking forward to so many things now. And I appreciate
My friends.
Yeah, and you're a great grandma, right?
Great. And I just made Valentines for all of them that tickled them to death. Yeah, and I wouldn't have that kind of energy for Valentines.
Wow.
Yeah, all of them got them. It's just such fun.
How terrific. Look at you having fun. This is great.
Yeah, they'll probably get a belated Valentine from me, Dr. Justin, his bunch.
That's
Yeah.
terrific. Well, thank you so much for coming in here and sharing your experience.